Okay, well, good evening, everyone. I sincerely apologize about the delay in opening up the doors. When you host a gathering, the last thing you want to do is not open the doors on time, but we were having some tech issues on our side that we wanted to resolve before we welcomed you in. And so I see that we have 9 attendees in, or 7 at this time. I know we're expecting 20. We are going to record tonight's session as planned. We were going to have it available live stream on YouTube tonight as well. However, that did not work out as planned. But the backup is we will have this recording available on YouTube at some point tomorrow, and it'll be up there for at least the next week or so. So thank you for bearing with us and for being prompt. Allow me to introduce myself. My name is Patty Smolin. I am the Business Liaison Librarian at the Schaumburg Township District Library. And I'm very, very pleased to welcome Mr. Tom Perrucci, who's going to speak to us tonight about an incredibly important topic on Medicare. I know that Tom is very active in the Schaumburg area and with the chambers and also with the public library circuit, bringing this information that we all need updated frequently to our public. And so I was really happy when Tom was available to team up with the library and to bring us tonight's topic. So the way that we're going to work this, if this is your first time in a Zoom webinar, you do have options, if you see at the bottom of your screen, for Q&A or chat. Either one of those will come to either Tom or to me. If you have questions throughout tonight's session, you don't need to hold those questions back. Please ask them as they come available to you. And then Tom will periodically take a pause in his content and we'll reflect on those questions and make sure that they're addressed for you. I am going to just enter into the chat before we get started. This is kind of a protocol that I do. This is my email address at the library. If there are any questions that you have regarding tonight's program, and I know Tom's going to share his contact info, but if you have any questions about tonight's program or about another program, either that I do or one of my colleagues do, or about resources at the library, you are most welcome to get in touch with me. I know that the library's hours are a little bit different, but we are still open, we are still active, we are still here to help in whatever ways possible. I'm getting a Q&A already. Let's take a look. Okay. So we have one question, and we're just going to make note of it. If you choose Medicare Part C, is that a permanent choice? And I have a gut sense that, Tom, you're going to be talking about that?
Sure. Yes, we will.
Okay, good. Okay. So with that being said, I want to thank tonight's speaker for partnering up with us. And I'm going to take myself off video and mute, and I'm going to learn like the rest of you, but I'm going to check back in as needed. And Tom, again, welcome.
Okay, thank you for having me. Okay, well, hi everyone. My name is Tom Perrucci. Again, we apologize for the delay. Things don't always work as planned, but I'm excited to be here and to share some thoughts with you on Medicare. The first thing I'm going to do is I'm just going to share with you a very brief video about Medicare. It takes about 8 minutes. It's an overview. And so it's pretty good. So just listen to it. Don't try to take everything in. And then I'll come back and go through a more detailed presentation and obviously take your questions. So if you just give me a second here, I will get that ready for us. And I'll be back shortly once the presentation is done. Thank you.
Thank you for joining this Medicare overview. Today, we'll be discussing Medicare basics from A to D, what Medicare is, who's eligible, what your coverage options are, and when you can enroll.
I'm assuming you can all hear that.
At the end
Can you
of this
all hear that?
discussion,
Somebody
you'll
just
have
say
all
yes.
the information you need to take your next step toward better health. So let's get started with the basics. What is Medicare? Simply put, Medicare is a federal health insurance program for both eligible citizens and legal residents, and is funded in part by the taxes we pay while employed. Since its inception, Medicare has undergone a few changes and additions, most notably the parts: Part A, Part B, Part C, and Part D.
Can you all hear that presentation? Okay, good. I just wanted to make sure.
legal residents of the same age who have lived in the U.S. for at least 5 consecutive years. Citizens and legal residents younger than 65 are also eligible with a qualifying disability, or any person of any age with a diagnosis of end-stage renal disease, or ALS, Lou Gehrig's disease. Chances are you meet the criteria for Medicare coverage. So what are your coverage options? As we touched on earlier, Medicare is made up of parts, which lets you more or less choose the coverage and benefits you need while passing on the ones you don't. Parts A and B are often lumped together and referred to as Original Medicare. You can have one without the other, as you enroll in both separately, but it's not advisable to do so. It's best to plan on enrolling in both Parts A and B to cover a wider range of health costs. Part A helps pay for hospital stays and inpatient hospital care. It also covers inpatient mental health care, skilled nursing services, hospice care, and some blood transfusions. Part B covers doctor and outpatient visits, such as physician services, outpatient hospital services, ambulance transportation, outpatient mental health, laboratory services, durable medical equipment, such as wheelchairs and oxygen, outpatient physicals, occupational and speech-language therapy, and some preventative care. Original Medicare covers many essential services, but it doesn't cover everything. Both Medicare Parts A and B have deductibles and coinsurance. While Part B requires a monthly premium, most people do not pay a Part A premium. Additionally, Original Medicare does not cover prescription drugs or offer additional benefits like hearing, vision, or dental. Long-term care or custodial care, such as most nursing homes, are also not covered by Part A or Part B. Most people agree that they need additional coverage beyond what Parts A and B offer. There are a few ways to get it. The first option is to enroll in a Medicare Supplement or MedSup insurance plan. MedSup plans are offered by Medicare-approved private companies. These plans are sometimes called Medigap plans because they help fill so-called gaps in Original Medicare. If you'll recall, Original Medicare doesn't cover everything. Actually, it only pays 80% of your out-of-pocket costs. MedSup plans are designed to help with the other 20%, such as co-payments, co-insurance, and deductibles. To be eligible to enroll in a MedSup plan, you must also be enrolled in Medicare Parts A and B and must reside in the state in which you are applying for coverage. As for age requirements, the general rule is that you must be 65 years old, though some exceptions are made for individuals with certain disabilities. Part D is an optional benefit that adds drug coverage to Original Medicare. However, there will be a penalty if you choose not to enroll in a Part D plan. Because Part D is also offered by private companies, the cost and extent of coverage will vary from plan to plan. It's therefore important to research different Part D plans to find the ones that cover the medications you need. And be aware, each plan's covered prescription drugs can change, and the dollar amount covered can fluctuate if you hit predetermined limits. To be eligible for Part D, you must continue to pay your Part B premiums. The third option is Part C, also known as Medicare Advantage. These plans are offered by private companies and can vary in the benefits they offer and therefore cost as well. But usually Medicare Advantage plans bundle Medicare Parts A and B, the hospital and medical coverage, into a single plan. One appealing feature of these plans is that many of them have $0 monthly premiums. Depending on the plan details, they may also offer additional benefits not covered by Original Medicare, such as routine vision care, hearing, and/or dental. To be eligible for a Medicare Advantage plan, you must be enrolled in Medicare Parts A and B and live in the county in which the plan service is provided. A Medicare Advantage plan, MA, with prescription drug, PD, coverage is also known as MAPD. MAPD plans give you everything a Medicare Part C plan provides, with the added advantage of prescription drug coverage. Like standalone Part C plans, many MAPD plans have a $0 monthly plan premium. Additionally, many of them provide extra benefits like transportation to doctor appointments, over-the-counter medications and supplies, and even health club memberships. As previously mentioned, these plans are offered by private companies. To be eligible for an MAPD plan, you must have Medicare Parts A and B and live in the service area where you receive coverage. Now that you have a basic understanding of Medicare's parts, as well as additional coverage options, it's time to talk about when you can enroll. While the government has different enrollment periods set up for beneficiaries, the annual enrollment period, also known as AEP, is from October 15th through December 7th of each year. It's an opportunity for people to enroll for the first time or switch plans and benefits from a previous year. Plans selected and enrolled in during this period go into effect on January 1st of the following year. This is the rule, but there are exceptions. For example, when you first become eligible for Medicare, you are entitled to an initial enrollment period, or IEP, which is a 7-month window that starts 3 months before the month you turn 65, includes the month you turn 65, and ends 3 months after. Plans selected during IEP generally go into effect the first of the month following enrollment, or the first of the birthday month. There are also special enrollment periods, or SEPs. SEPs allow you to enroll or switch plans due to special circumstances, and the effective date is generally the first of the month following enrollment. And that brings us to the end of our overview. We know you'll have questions, so please feel free to reach out anytime. We can answer all your questions in much more detail and provide solutions that are tailored specifically to your healthcare needs. But for now, thank you for joining us today. Hopefully we've made Medicare seem a little less overwhelming. As a parting word, a few next steps we suggest would be to review your enrollment periods, research your options, ask questions, get answers, find financial help if eligible, enroll in a program, and each year conduct a yearly review. When the time comes to make a decision for your Medicare plan, it is essential to speak with a licensed agent for guidance. We want to make sure we provide you with all the options and help you pick a plan that is best suited for you. Thank you for your participation.
Well, I'm back again. Thank you so much for your patience. That was an overview of Medicare. It did cover a lot. I'd be surprised if all of that sunk in correctly, but Medicare is a large topic. And so what we're going to do now is I'm going to open up another screen and go through some more details about Medicare. And please feel free to give us your questions. I know people have lots of questions. My experience with Medicare is it takes a few passes, a few exposures to begin to understand Medicare, how all the parts work, and how it could best work for you. So don't get frustrated. With Medicare, you'll find there's a lot of acronyms that go around. There's a lot of half-truths. A lot of your friends and neighbors have different experiences with Medicare. And then to add to the challenge of understanding Medicare, when you first begin to turn 65, your mailbox begins to become inundated with mail and TV commercials from celebrities, which makes it even a little bit more challenging to understand at that point. Okay, so if you're all there with me, I believe we have a good dozen attendees here. Can you all hear me okay? Okay. Are they unmuted, Patty? Can they hear me okay?
Everyone is unmuted unless they have muted themselves.
Okay, all righty. All right, so we're going to go to the presentation now. So if you just kind of bear with me, let me see if there's any pressing questions that I can answer now. Otherwise, we're going to go to the presentation. Okay, here we come. Okay, so here we are at the presentation. There I am. There's a picture of me. If you want to write down my phone number, that would be great. If you want to take a picture of me and sell it on eBay, good luck with that. good luck with that. So this is Medicare 101. You don't need to worry about this. This is my state license. I am licensed by the state of Illinois. There I am. There's a picture of me with my wife, Jackie. I'm with the Geico man. He's a client of mine, obviously. We've been in Schaumburg for 30 plus years. On weekends, I enjoy marrying couples as I am an ordained minister. Medicare is loaded with acronyms, so we're just going to look at this page. Don't worry about it. There's only 64 acronyms in Medicare, which makes it a lot easier for you. So again, we're going to review what is Medicare, who can get Medicare, what are your coverage options, when you can enroll, when you can make changes, and what are your next steps, and where can you go for help. Medicare was signed into law by President Johnson on July 30th, 1965. In 1965, I was 14 years old. And in 1965, the #1 single on the charts was Wooly Bully, in case you wanted to know that. The Dodgers beat the Yankees in the World Series. And in 1965, we had lots of civil unrest in our country. And there was a lot of things going on there in 65. Just some notable changes to Medicare there. We won't go through all of this. You can see the history of Medicare. It has not really been around that long. It's added additional parts. We'll discuss those. And so very briefly, Medicare is federal health insurance for citizens and legal residents. It's funded by the taxes you paid while working. It is individual health insurance. Medicare is not a family health plan. So if you are married to a spouse, you both need to have a Medicare plan. It is not Social Security. It is not Medicaid, and Medicare is not free. Again, people who are eligible, United States citizens or residents who've been here 5 consecutive years, people over 65, or younger than 65 with a qualifying disability. These are just the agencies that are responsible for Medicare. On the left there, you see Social Security enrolls you in Medicare, as does the Railroad Retirement Board, and the CMS, the Centers for Medicare and Medicaid. They regulate Medicare. This is the new Medicare card. If you're aging in or if you already have it, this should be recognizable. You have a Medicare 11-digit number, and you have your hospital Part A and Part B. This is the back of the card. When you first are aging into Medicare, and you receive this card from the government, if you for some reason do not want Medicare, you can sign this card and return it to them, and they will not enroll you in Medicare. Okay, we went the wrong way. Getting your Medicare card. If you are drawing Social Security when you turn 65, you will automatically be enrolled in Medicare. And it will begin the first day of the month you turn 65. Typically, these cards have been arriving about 100 days before your birthday, but with the COVID virus, the mail has been held up. So that would explain the delay. If you do not get Social Security when you first turn 65, which lots of people are doing now, they're delaying Social Security to later ages, or they're still working, you will have to enroll yourself. Medicare will not automatically enroll you. You can enroll by going online, by calling the Social Security, and you cannot go in person right now, but you can call your local security office. So it's very important to keep that in mind. The government will not send you a letter if you don't enroll when you first turn 65 or you continue to work. It's up to you to enroll in Medicare. Medicare has several parts, A, B, C, D, and Med Sup. I suppose the government feels that we did not learn our ABCs adequately, so they want to remind us of the parts. So what we call original Medicare, let me go back there, is parts A and parts B. You see in that screen there, your Medicare choices. Our original Medicare is step 1 is parts A and B. A covers your hospital and facilities. B is your medical services. That is what we call original Medicare. Then step 2 is supplemental coverage to original Medicare. Original Medicare only covers 80% of costs. And so in order to close the gap, so to speak, of that 20%, you have two different options. On the left side there in the red, you can pick up a Medicare supplement plan by a private company and add drug coverage. Or option two, you can enroll in a Medicare Advantage plan, which is also known as Part C, which most Advantage plans will include your Part D, which is your drug coverage, as well as other additional benefits. And we'll talk about these more specifically as we go along. So just think A and B is original Medicare, and then the two additional ways to cover your exposure are a Medicare supplement and a Medicare Advantage plan. Most of you are probably familiar with these terms and definitions in insurance, so we'll just kind of take a quick peek at those. Again, Part A covers the hospital. Think of Part A as your facilities, skilled nursing, hospice care, and blood transfusions. Part A for most people is premium free. If you or a spouse worked and paid taxes for 10 years, you can't be denied coverage. It works all over nationwide. And the thing about Part A is even if you continue to work and are not taking Medicare, it's always wise to take Part A because it's not going to cost you anything and rarely does it conflict with any other health insurance that you may have. That is Part A. Part B is the services you receive from the doctor in and out of the hospital, your durable medical equipment and preventative care. Part B does have a monthly premium. Part B does have a monthly premium. Currently, that monthly premium is $144.60. It is adjusted for income. And again, coverage is nationwide. And there is a penalty if you enroll late in Part B. So Part B, whether you have a Medicare Advantage or a supplement plan, you always pay for Part B. The only time you don't pay for Part B is if you're getting Medicaid or you're getting help from the government, and then they may pay your Part B costs. Medicare is good, but Medicare does not cover everything. Medicare does not cover prescription drug coverage. It does not cover things like hearing, vision, and dental, does not cover long-term care, custodial care, and it does not cover excess charges. Doctors who accept Medicare are allowed to bill Medicare 15%, up to 15% more than the bill, and Medicare does not cover that. These are the 2020 costs of Part A, which again is the hospital cost. This is if you just have Medicare. Again, for most people, the premium is $50. They have a thing they call a benefit period under deductible. What that means is when you're admitted to the hospital, you owe the government $1,408 for that admission period. That's good for 60 days. And so if you leave in 2 days and come back 3 weeks later, you don't have to pay that. However, after the 60th day, if you're out of the hospital for 60 consecutive days, you will have to pay that benefit period again. So you can see how if you don't have additional coverages, you're making yourself open to additional costs. Part B, again, monthly premium is $144.60. There is a yearly deductible for Part B, which is a very affordable $198. Lots of people under 65 wish they had a $198 deductible. And then once you meet your deductible, again, Medicare pays 80% and you are liable for 20%. That is the challenging news about Medicare. There's no gap to what you could spend. The good news about Medicare, there's no out-of-pocket limit to what they'll give you. Medicare Advantage plans, those are called Part C. Think of those as all-in-one plans. They combine parts A and B. They typically include your drug coverage. Again, these are offered by private companies, and the attraction to the Medicare Advantage plans is that they offer additional benefits that Medicare does not offer, like hearing, vision, and dental, and so forth. To be eligible for C, you have to have parts A and B. Medicare Advantage plans are tied to an area where you live. You have to live in the service area, and there's no underwriting, and there's no, they're all guaranteed issue for everyone in those particular plans. Again, these Medicare Advantage plans, the premiums can change each year. You always pay your Part B. The attraction of these plans are that they're all in one inclusive. You do not leave Medicare when you get a Part C plan. Think of it as you're getting your Medicare now through the Advantage plan. And they do offer, again, additional services like prescriptions. They're limited to an area where you live. You may or may not need to get a referral with a doctor. And again, the attraction is they offer additional benefits, and many of the Advantage plans have a 0 monthly premium. Again, not free, but the premium is 0. There's different types of Part C plans. Most notably, most of us are familiar with the first two. They're either HMOs or they are PPOs. Part D is your prescription drug coverage. And again, these are offered through private companies. Each company has a formulary and that they put in tiers, and the tiers begin at 1, they go through 5. Lower cost generics are in tiers 1 and 2. As you go up in the tiers, the cost of the drugs go on. It's very important when you get prescription drug coverage to make sure that your drugs are with the carrier that you are going with and which tier they're on. The same drug could be on a different tier with different companies and could cost differently. So it's very important to do your homework when you're exploring Part D coverage. Every company by law is required to have 2 drugs in every category. Sometimes you may have to try a different drug or a different generic to get a drug, but each plan has to provide 2 drugs in each category of coverage. Again, Part D plans vary from plan. There's different monthly costs, and they all have different formularies, which is a list of drugs, and they all price their drugs a little differently. Part D is quite honestly is a very challenging part of Medicare. There are stages that you go through. You've probably all heard these stages from other people who are already on Medicare, or if you're in Medicare, you move through stages, and most people understand Part D in terms of the donut hole. This is just a chart to show you how the stages work. Part D plans do have a deductible. The deductible could be up to $445 in next year, 2021. Some plans will have you pay the deductible. Some plans will waive the deductible, so that's why it's important to look at each plan. After you pay your deductible, you go into the initial coverage stage, and that's where there's copays and coinsurances. Typically, those are very affordable at that stage. If you reach a limit of $4,130, as you could see by that arrow, you go into the coverage gap. That used to be called the donut hole. In the coverage gap, you're paying 25% of the cost of a generic or a brand name. If you get into the coverage gap, your prescriptions will go up from your initial coverage when you first get prescriptions, because you're only paying a small portion. When you get into the coverage gap, however, you're paying a larger portion. You stay into that till a period of time until you reach $6,550, and then they put you in this horrible stage called the catastrophic stage, where you're paying a very minimal amount for a generic or a brand drug. Okay, Medicare Supplement plans. Again, these are plans by private companies. These are lettered plans. They're all standardized, meaning that each company that offers Medicare Supplement plans They have to provide all the same services of those plans. However, the companies can charge a different premium, and they can offer different additional benefits to their plans. This is a chart of the current Medicare plan options, and most people are familiar with F, G, and N. Those are the three most popular. F plans have been phased out for people beginning in January 2020 if they're aging into Medicare or they're turning 65. If you had Part A before 2020, you can still get Part F, but if your birthday is after January 1st of 2020, you no longer can get Plan F. People then are gravitating to Plan G, and another popular plan is Plan N. The supplements, again, you have to have your parts A and B in order to get a supplement and live in the state in which you apply for coverage. You have to be over 65 or have a qualifying disability. Medicare supplement plans, just some quick facts. There's no medical underwriting when you first are eligible for plans, which could either be turning 65 or 6 months after you get your Part B. Again, if you delay your Part B because you work for an employer, that start date, you have 6 months to enroll in a supplement plan. There's no underwriting, there's guaranteed issue. You will not be charged any more because of pre-existing conditions. And again, as with a Medicare supplement and Medicare, you must continue to pay your Part B. Okay. Let me stop here, and Patty, if you would let me know if we have any questions at this point that maybe I could answer.
I'm reading through all of the chats we had, and they were all just affirmations that everyone was hearing clearly. And I think the last question that we had was the first question that came in, which was about Medicare Part C and is it a permanent choice? And that is the only question that I've received.
Okay, so let me talk about that a little bit. Are you seeing the chart right now with the supplements and the Medicare Advantage plans?
Yes.
Okay. So let me talk about, these are the two options that people use to supplement their original Medicare. If we just start with the chart on the top, Medicare supplement plans and Medicare Advantage plans are both offered by private companies. When you think of the Medicare supplement plan, Medicare supplement plans work throughout the entire United States. Think of it almost like your car insurance. You get your car insurance in Illinois, but it works everywhere in the country. Any provider or facility that accepts Medicare will accept a supplement plan. You do not need any referrals with a Medicare supplement plan, and you're not tied to any network. On the reverse side, with the Advantage plans, you may be required to use doctors in the network. You may or may not have to see referrals, and you may have some network restrictions. Medicare Advantage plans are not permanent, and what I mean by that, they are like marketplace company insurance plans. They run from January to December each year during the annual enrollment period. You have an opportunity to switch Advantage plans, to drop Advantage plans, to get a different one, or to go back to original Medicare. So you're not tied into Part C plans other than in the initial year. And there's only specific times when you can enroll in a Medicare Advantage plan, specifically when you either A, are first turning 65, or you're first enrolling in Part B. And when you watch your TV in October, when they talk about the annual enrollment period, that is the time when you can make changes to your Advantage plans. Medicare supplements, you can enroll anytime during the year. Again, they're just like car insurance. They're not tied to enrollment periods. And so you're free to change those anytime you win. Generally, again, the attraction of the Advantage plans is they have zero premiums and they have additional benefits that Medicare supplement plans do not have, like dental, vision, hearing, fitness, and so forth. Okay, enrollment periods. These are very important because one of the challenges with Medicare is you have to enroll at the right time, that if you don't, you're either liable to have your coverage delayed or incurring a penalty. So the initial enrollment period is the month you turn 65, 3 days before, 3 months before, I'm sorry, and 3 months after. That's the 7-month window when you can first enroll in Medicare. It is always advisable to do it before 65 rather than after, because you do not want to delay enrolling in Medicare because your coverage then will start. And so this is the first time you have an opportunity to enroll in parts A and B. Again, if you decide that you don't want to enroll in Medicare right away because you or your spouse or you're working at a company that offers you health insurance and you want to work till you're 67 or 68, you can delay Part B and you can have another enrollment period at that time. But this is the initial enrollment period that everybody has. Then there's the general enrollment period. If you miss your initial enrollment period, and for whatever reason you just didn't do it or you forgot, the government allows you to have a general enrollment period where you can pick up parts A and B and part C and D. This is if you miss it. The problem with this general enrollment period, if you look there, these plans will not start until July. So if you miss your, say your birthday is in October and you have 3 months before, 3 months after, and you have till January to enroll and you fail to do that, then you could go into this general enrollment period, but then your coverage won't start until July. So it's very important to pay attention to enrollment periods, because you will either, again, delay your coverage or you will get penalties. Special enrollment period, that's if you continue to work. So people sometimes get concerned that they missed their initial enrollment period, they're going to get penalized. No, if you're working or a spouse is working and you have health coverage, you're fine. As soon as you know that that coverage is going to end or you're going to retire, then you have 8 months to enroll in A and B. You don't want to wait that long. Obviously, you want to enroll right away to avoid any penalties and to make sure that you have continuous coverage. So it's always important to make sure that you time when you're leaving a company plan to when you're going to get in Medicare. This is the Medicare Supplement, has its own open enrollment period. Again, this is one time that you have this. When you first turn 65, you have 6 months from your 65th birthday to enroll in a Medicare supplement. The reason this is important is during this open enrollment, there is no medical questions or underwriting. So this is very important for people if they have health challenges. The plan cannot deny you coverage or charge you more money because of your health conditions. So if you have some health challenges and some concerns and you're leaning towards a supplement, you want to make sure that you enroll within the 6 months from your birthday on to have guaranteed issue. Most of the carriers allow you to enroll before you turn 65 to have it start on the first, have it start on your birthday month. The reason this is important is if you don't enroll during your open enrollment, the companies could ask you medical questions and underwriting, which means you may be denied coverage or charged more. Okay, hang on there. You're still with me, I hope. People ask about when they can make changes to their coverages. Well, I mentioned before, during the Medicare annual enrollment, which is October 15th through December 7th, you are allowed to make changes only to Medicare Advantage and Part D plans. So if you have a Medicare Advantage plan, you can drop it and pick up a different carrier, or you could go back to original Medicare. If you have a Medicare supplement, this does not apply to you, but you can change your Part D if a better plan comes back, or if your prescriptions change or your costs go up and you may want to take a peek at another one. This is the time when the TV is nonstop, where Joe Namath is telling us about these Advantage plans. This is all the hoopla about this. This is the one time, other than a special enrollment period, you get to make a switch. Medicare does have its own open enrollment. This is, I like to think of this as buyer's remorse. Again, this is for people in Advantage plans only, and people in Part D who made switches during this time, and then they come over here, and then all of a sudden they're talking to their neighbor, and she said, oh, I have this plan, it has this, this, or this, and then you realize that, oh, maybe you'd like to have that plan. The government does allow you to make one switch within that 3-month period. There are special enrollment periods if you have qualifying events that allows you to make changes again to your Medicare Advantage and your Part D. If you move out of an area, if you lose your employer coverage, if your finances change where all of a sudden you're getting help from the government, you receive assistance, you get back on Medicaid, there are special enrollment periods. The government wants us to pay attention to enrollment periods. If we don't, they will actually give us penalties. There's a penalty for Part A, Part B, and Part D. We won't go through those in detail. Just note that there is a penalty. And the Part A penalty is 10% for every month for twice the number of years your enrollment was delayed. So if you only delayed your enrollment 2 months, they're not going to penalize you, but if it goes after a year, you're going to pay a penalty. The Part B, they will penalize you 10% for each 12-month period. The Part B penalty and the Part D penalty, those are permanent penalties. You'll have those as long as you have Medicare. So it's very important to pay attention to the enrollment periods. The penalties are not that high for Part D, as you can see from this chart, if it's just for a few months, but if it goes on, it adds up. Penalty is usually the average cost of a drug plan monthly, which is about 32 to 40 cents. IRMA, this is IRMA. If you make more, the government takes more. Remember I mentioned to you that there's a Part B premium for Medicare, it's $144.60. That's what most people make. But if you have a higher income, the government will charge you more. And what they do is they look at your taxes every 2 years, and if your income is over those levels at the bottom there, you could see it's either $87,000 a year for a single or $174 for a couple. You will charge more, and that's adjusted every 2 years, and you can appeal it. So just be aware of that. If you have a higher income, you will pay more for your Part B or Part D, or if you get an inheritance or sell some assets, and all of a sudden 1 year your income goes up, you may have a surcharge on your Part B and your Part D. Okay, these are just obvious things. The next steps is always to review your enrollment periods, make sure you understand those, do your homework, ask lots of questions, get answers. If you qualify, look for Get Financial Help, enroll, and then every year it's important to do a yearly review. There's lots of resources for you. Each year the government publishes this Medicare and You book, which has everything that you need to know about Medicare. It's in there. I know people don't generally read it, but with Medicare, it's your responsibility to know about enrollment periods and penalties and so forth. It's just like when you do your taxes. You can't come back to the government and say, nobody told me, I didn't know that. They're going to say to you, it's all there in writing, just like when you do your taxes, it's your responsibility. So it's important to understand that. Medicare.gov has their own website, which has lots of information about Medicare. Once you join Medicare, it's a good idea to go on there, create an account, and there's lots of helpful information there about Medicare. There's the Medicare numbers, which is available 24 hours a day, 7 days a week. Also, each state has their own CHIP program, which kind of helps you out, as does your local Social Security agency. Okay, it's 7:35, so let me stop here and take some more questions. Hello, Patricia, we have some questions.
Do you see the chat coming in, or would you like me to read it to you?
Let me do this. Let me stop my share. Okay, let me look at the chat.
It's about signing a little late.
I signed in a little late. When is the open enrollment for supplemental coverage? Oh, well, there's the initial enrollment for a supplemental coverage is 6 months from when you turn 65. You have 6 months when you turn 65, when you have A and B, to get a Medicare supplement plan. Or if you are delaying getting Part B, then you have 6 months when you get Part B. So it's either 6 months from your birthday month or 6 months when you get Part B. Okay. Do we have some other questions? Okay. Oh, same question. I already have supplemental coverage, but if I want to switch plans, you can switch supplemental plans anytime. There's no enrollment period for those. Those are like your car, your homeowner's insurance. You can switch them anytime. The challenge with switching the supplemental plans, depending on when you do it, is the companies can do underwriting and ask you questions, which means that you may either be denied or have a higher premium, but you can still switch supplements anytime that you like. That first initial enrollment period in the supplements, you have guaranteed issue. There's no underwriting, but after that guaranteed issue, there is underwriting. So that's a challenge. That doesn't mean you shouldn't do it. I switched a lady 83 on a supplemental plan. Now, one of the nice things about living in Illinois is that there's one company in Illinois that never does underwriting for supplemental plans. So that's always an option here in Illinois. This is an educational seminar, so I don't want to talk specifically about carriers, but just know that that is available to you. Okay, here's another.
Patron is that she asked, so we have 3 other questions on Q&A, but on the chat, there are some more things coming in.
FG and beyond.
It says, I've been on Medicare.
Okay, I see some of this. Okay, a little bit more about FG and beyond. Again, F is no longer available to people aging in, unless you had Part A when you first turned 65. So they're phasing that out for new enrollees. If you currently are in Part F, you don't have to do anything as long as you pay your premium. The reason people liked Plan F is it covered everything. It covered the yearly deductible and excess charges. Part G is the only difference between Part G and Part F is with Part G, you have to pay the $198 deductible. Other than that, it covers everything that Part F covered. Typically, Part G is lower than F, and so usually the difference in that lower premium is worth it for people to switch. And then another popular plan is Part N, and Part N is more affordable than Part G. It has a little copay when you go see a doctor or a specialist. Most people at this point are going to take Part G or to take Part N. Okay, I saw some other questions here. Is there any additional requirement other than having over 20 employees to be considered certified for employment pass? No, as long as your company has 20 or more employees, then your coverage is credible coverage. It's always good if you're going to continue to work with a company and keep their insurance, to just double check with them to make sure that you have credible coverage, with the Part B as well as with Part D, which is your prescription drugs coverages. Let me see some other questions. I've been on Medicare for 1 year and already there's a monthly increase. Yes, that happens. They have increases during the year. One of the challenges, I'm going to assume that you're talking about the Medicare supplement. Medicare supplements do go up. One of the challenges with them is when you first turn 65, they are very affordable, but as you age, they do go up, and it becomes challenging as you get older, that they continue to go up. Whereas with the Advantage plans, typically their monthly premiums are zero, and people begin to start considering the Advantage plan. But that's something that you have to review with a licensed agent to make sure that you have the best coverage for your health and then for your needs.
This is Patty. If you want to toggle to the Q&A part, I think some of the questions have come through on chat, and we still have a few on Q&A.
Okay.
I'll read one to you to get us started, if that's okay. My wife carries our insurance now. I will continue to work after I turn 65. Should I sign up for Medicare?
In that case, I would sign up for Part A, since it's premium free. So that's not going to interfere with your company coverage. As long as if your company is providing you your medical insurance, you can delay your Part B. But I would go ahead and get Part A, and then once you get your Part B down the road, when your wife retires, then at that point you could sign up for an Advantage or a supplement plan.
Okay, next question. I have insurance through my employer, but signed up for Part A when I turned 65. I had to go to the hospital for 2.5 days, but Medicare did not pay anything. Do you need to stay in the hospital for 3 days in order for Medicare to pay?
You'd have to, without knowing the details, you'd have to check with your company. If you had insurance through your company, then they're going to be the first payer. So that would be a reason why Medicare wouldn't pay anything. They would be the first payer. So no, you don't have to stay in the hospital for Medicare to pay anything. I'm going to assume that the company's insurance was primary, and so Medicare never got the bill and obviously wouldn't pay it.
Before I take you the next question, I want to make mention that in the chat feature, I have included all of Tom's contact information as well. And if you did register for tonight's program and you had your email address provided and you received the Zoom link in, he provided us with a 2-page handout that I sent out a few hours before the program started. But in the chat right now is all of Tom's contact information in sight. So another question, we hope to travel in retirement. Are we better off with Medicare F, as in Frank, or an Advantage plan?
Okay, is that in the chat?
That's in the chat.
Okay. So the question's about traveling.
Mm-hmm. We hope to travel in retirement. Yeah.
Right. Okay. Two things on that. First of all, with the Medicare supplement, the Medicare supplement works everywhere in the country as long as the provider accepts Medicare and the Medicare and is willing to bill them. So with a Medicare supplement, it's like having car insurance no matter where you go. If you go to Arizona, you go to Florida, you go to Tennessee, Medicare supplement is going to work everywhere. So that's not a concern. The Medicare Advantage plans, one of the unique things about the Advantage plans is they are tied into an area where you live. So if you live in Schaumburg like I do, you have to have a plan that is tied into Cook County, and you have to get your health care in that area. Advantage plans, however, for emergency and urgent care, you can go anywhere. So if you're in Lake County and you stub your toe on the beach, you don't have to drive back to Cook County in order to get coverage. Now, the challenge with the Advantage plans is what happens when I go to Arizona or Florida or Tennessee for the winter. In that case, it's very important to understand your particular Advantage plan. Some of the Advantage plan carriers operate differently when you travel. There's particularly two companies that they allow you to use their Advantage plan wherever you are in the country. They have a national network, so it doesn't matter if you're in a different state, you can use the plan there just as if you were here. But you have to be careful if you get an Advantage plan. Not all the Advantage plans will cover regular care outside of your area. Of course, they'll cover urgent care, but we're talking more about regular care. So again, if you're interested in the Advantage plan, they will work when you travel. You just have to make sure that you have a carrier that has a nationwide network that will allow you to use their plan wherever you may find yourself. Medicare does not work outside the United States. And so that's very important to understand that. It does cover emergency services up to most supplement plans, and Medicare Advantage plans will cover up to $50,000 in emergency services. But understand this, that if you travel outside the country, it's always good to check with your travel agent and perhaps to pick up some additional services, depending on what country you're in. If you get sick and you go to the hospital, they're not really impressed with your Medicare, your Medicare, or your Advantage or your supplement. The only thing they want to see is MasterCard. So just keep that in mind. And my advice to you is pay a bill if you have to. Then when you come back to submit it to your carrier. I saw a question about Medicare capping costs. There's no caps with Medicare. That's the good news about Medicare. There's no caps to what they cover. The challenging news about Medicare is you're always liable for that 20%. With Medicare Advantage plans, to bring this up since we're talking about caps, they also have caps. And so if you spend so much money in a year with a Medicare Advantage plan, the plan goes to zero. An easy way to understand the difference between supplements and the Advantage is the Medicare Advantage plans, you pay up front whether you use the plan or not. Again, it's like your car insurance. So you pay $150 a month, whether you use it or not. Medicare Advantage, they're a little different. You pay as you go, and you pay low copays and co-insurances. So you pay a low monthly premium, but when you use the services, then you pay a fee, which generally are still fairly low. You go see a doctor for $0 or $5, you see a specialist for $30. And if your costs for an Advantage plan ever add up to a certain figure, then the plan goes to zero. So you are protected that way. Generally, people that don't have as many health concerns are attracted to the Advantage plans if they're only seeing a doctor once or twice a year and they're generally healthy. They don't see a reason. They can understand to have a zero premium plan if their costs are, if they're only going to go see the doctor once or twice a year. Okay, let me see what else we got down here in the chat.
I think that we have addressed all of the Q&A and all of the questions in chat, Tom.
Well, now I'm going to give away tickets to the Chicago Bears game.
Wait, don't talk too soon. I think wait, did something else come in? Here we go. I spoke too soon. I have one more question. Do
Okay.
most people have a supplement or the Advantage plan?
Ha ha. Well, the statistics that I read that's put out by the Kaiser Health Foundation is there, depending on which part of the country you're in, they vary. However, what they're telling us is about it's pretty close the same. It's like 40 to 45% of people will have a supplement or have an advantage, and then the rest of the people just have original Medicare. Typically, if there is a more affluent area and people can afford the supplements, they tend to gravitate towards those. In city areas, people would gravitate more to the Medicare Advantage. But however, that's not true across the case. There are people that could afford the supplement but choose to have the Advantage plans. The Advantage plans are newer and they're getting better. They have better benefits every year. As little as 3 years ago, the only zero Advantage plan in this area were HMOs, and some people don't care very much for HMOs. Last year, 2 carriers came out with zero PPOs, and then this year, in the fall, there's going to be more carriers. So the companies are listening to people, and they're giving them what they want. People that are, again, a little healthier and like the Advantage plans, and they like getting, $1,000 to $2,000 dental benefit. They like getting eyeglasses. They like getting hearing aids. They like the fitness. They like getting products. They like the telemedicine. All these things that, with original Medicare and a supplement, typically you would be paying those out of pocket. Particularly the dental, the vision, the hearing, the fitness, and so, and then again, in different parts of the country, Advantage plans are stronger than supplements because they have better. The plans are getting better all the time. Generally, what I find is that people are used to company insurance and they gravitate towards the supplement. The challenge comes that as they age, the supplements go up quite significantly. And if you have a couple, in their 70s, you could be paying, hundreds of dollars a month for a supplement, whereas you could get an Advantage plan for a zero monthly premium. Some people, once their supplement hits their max out of pocket with the Advantage, they're already paying the max out of pocket. The challenge with Advantage plans sometimes are in the areas of the durable medical equipment. Advantage plans typically you'll be liable for 20% with those. Sometimes they're a little bit. I always tell people this: every insurance has holes in it. There is no perfect insurance. The perfect insurance is if you're independently wealthy and you can afford anything out of pocket. So that's why it's important every year to review your options, to understand what your comfort level in working with an insurance company and a plan, your finances and your health, and you have to pick a plan that's best for you. It's nice when your friends say, well, I have the Advantage, it's better, and I have the supplement, but they're not you and they don't have the same needs and the same mindset. If you tend to be a person who is a little anxious about your health care, the Advantage plan may be a challenge if you have to work with networks. However, if that's not a concern, then you have to consider everything. I have clients that are happy with both. They both work well. They just function a little differently and they cost a little a little different. Okay.
Well, Tom, I think we are covered on the questions.
Let me
And
see if we have
is
anything
there any
else.
other material you would like to address?
Let me okay, there's no more questions. Again, you know, I remember the first time my wife and I turned 65, we literally had 4 agents from 4 different companies visit us in our home. 4. And I thought I was fairly intelligent, could understand it. It took almost 4 times around till you start getting it. So don't get frustrated. It's something that you're always learning. There's always lots of pieces. You just need to know enough to make sure that you have a plan that works best for you. Let me just, if I could, Patty, I'm just going to show them one more screen.
Sure.
And then I'll be done. And then if they want, you know, if you need help in figuring out Medicare, I'm happy to help you. There's never a charge for my services. And you know, I always tell people, you know, you could kind of sweat it out on your own and go through all that mail, or you could have somebody else help you. Let me just bring something back up here on the screen. And can you all see this? These are just,
Yes.
okay, just by, you know, I work for you, not the insurance company. I don't charge you anything. Don't worry about that. You don't pay me. If you enroll in the company and the insurance company, they pay me. So I'm not I'm not obligated to any particular carrier. I'm registered with all the main carriers and certified. So you don't have to worry about that. I could possibly save you money and help you get the most benefits. I am a specialist. This is what I'm doing as a licensed broker. Each year I have to take tests with each carrier in order to sell Advantage plans and supplement plans. And so, again, I've been on Medicare myself, and I know how confusing it is and to go through all those choices. And then the final thing is I'm a neighbor. I live here in Schaumburg. I'm not an 800 number. So if you have questions or concerns, or if you become a client of mine and you have problems with your insurance, you could give that to me. Again, I never charge for my services, and I could get on the phone and try to help you with that. I become like your customer service and your back office, or you could get on the phone with an 800 number, and we all know what that's like when you talk to insurance companies. And I think I am done. I think, Patty, you gave them my contact information earlier.
I did. And again, I want to thank everyone for making time and registering for tonight's program. Also, a reminder that at some point, I'm expecting tomorrow afternoon that this recording will be up on the library's YouTube channel if you want to view the slides again. And Tom, it was a pleasure to work with you.
Yes. Okay. Thanks for having me. And again, to
We'd
your
like to invite
guests,
you back another time. Thank you.
I'd love
Everyone
to come
stay
back.
healthy, and please do tap into the library if there's something that we can help you with. We are opening our doors tomorrow morning, and I will be there along with my colleagues.
Yay.
So take good care, everyone. Thanks again, Tom.
Thank you. Bye-bye.